The Premier has admitted that the state's health system is under substantial pressure. Healthcare workers have been saying for some time that they're struggling to cope. The system's stretched by a dramatic escalation in case numbers and severe staff shortages. And we've been warned that case numbers will continue to rise sharply over the next few weeks.
The system is already groaning under pressure, and the Premier says to brace for more.
We do expect to see a sharp escalation, a continued escalation in case numbers, but the experience around the world with Omicron is then followed by a sharp decline.
We expect for the next several weeks that we will see that pressure.
And it is being felt right across the state. Healthcare workers are struggling.
Overtime is at record levels. Everybody's doing extra shift. The hospital itself seems to be functioning on the goodwill of the nurses and them doing overtime. I myself did an extra shift yesterday.
There is no doubt we're seeing substantial pressure on the system, not just in New South Wales, around the country.
More than 3,000 health staff were furloughed yesterday because they have COVID or are a close contact.
The suggestion that people are being brought back to work when they're positive is certainly we have no evidence of that.
I think the plans they've got in place are going to have to do, and they're going to have to rely on my colleagues and I just to take the burden, do the overtime.
More records are tumbling, with 35,000 cases detected. There's almost 1,500 in hospital, 119 of those in intensive care. 8 people have died, including one person who had 3 doses of the vaccine. More than 16,000 boosters were given in New South Wales health clinics yesterday. That's the highest daily number so far. Plenty were lining up for that extra bit of protection in Macquarie Fields today.
A number of our friends have had it or have it at the moment. Just trying to do everything we can to protect ourselves.
Obviously it's quite concerning, like 35,000 cases today. I think the key indicator is hospitalisations, but hopefully that's under control.
There are still thousands lining up at testing clinics, prompting a new messaging campaign to educate people about changes to testing rules.
Putting up signs to say don't get tested may be necessary, but it should not have come to this. Resources should have been put in place.
For the last 2 years, we've had strong communication that please get tested, and everyone has made that effort. But as we move through this next phase, our response needs to change as well.
Another pivot in this ever-changing pandemic. Kathleen Calderwood, ABC News, Sydney.
It's now hitting home just how much the Omicron wave is impacting on our everyday life. Supermarket shelves are looking bare, childcare centres are closing, cafes and restaurants can't open because they don't have the staff. With so many workers off sick with COVID, the disruption is causing stress and frustration among the public. Alison Shao reports.
It's becoming more and more obvious. Staff who provided vital services throughout lockdown now too sick to work. And staff shortages are expected to get even worse.
On a typical day in Australia, between 3 and 4% of the workforce calls in sick. In the coming weeks, we could see that increase 10 times. We could easily have a situation where 1/3 of workers in New South Wales are absent from work.
Today, more than 300 childcare centres are closed around the state due to COVID, and parents are worried.
That would be a problem for us because then I'd have 2 little ones at home, a newborn and a toddler.
Yeah, we're definitely concerned about that.
Supply chains are being crippled by workers getting sick, all at the same time.
We're seeing abattoirs and processing facilities on the eastern seaboard either working at next to no staff or closed.
The shelves have been a lot emptier than they normally are.
Yesterday I was looking for water. I didn't find it. All they said was empty.
Tourism and hospitality businesses hit hard by staffing issues say financial support is needed.
The days of JobKeeper and that won't come back, but I'm sure there's other measures that can be discussed.
You cannot have a healthy economy without healthy workers. And it was always a mistake to say there was some kind of trade-off between protecting health and protecting the economy.
But the Premier says staffing woes are in part being caused by the worried well.
People believe they cannot go to work because they are deemed to be a close contact when they are actually not one.
Industry groups say access to rapid tests is what's necessary to keep workers and the economy moving.
There is no dollar figure that we will not put on the table to ensure as we move through this next phase, rapid antigen tests are available to anybody.
It's yet to be seen which industries will benefit from the Premier's promise of free testing kits. But with supply issues and fast-changing messages from both the state and federal governments, it's unclear how much relief there will be and when it will come. Alison Shao, ABC News, Sydney.
Well, school's back at the end of the month and understandably many parents are worried about their kids catching COVID. Among the measures aimed at addressing those concerns, from Monday young children will be eligible to be vaccinated, and the state government will also be directing some of its rapid antigen tests to schools. Kathleen Calderwood joins us now. Kathleen, is the government confident that this return to school will go as planned?
Juanita, despite the number of businesses and childcare centres that are struggling to operate with staff in isolation, today the Premier sought to assure families that his government is doing everything it can to avoid similar issues in schools. This will be another big test for Dominic Perrottet, and he's flagged it may not go perfectly, not ruling out isolated school closures if needed. But he says some of the millions of rapid tests the state government has ordered will go into schools. Now, families are also being urged to get their children vaccinated as soon as they can, with 5 to 11-year-olds eligible from Monday. The state's chief paediatrician says the vaccine is safe for children, and he said that some of the common side effects experienced by adults, like fever and muscle aches, are relatively rare in little kids. But he did say that parents and families should try to make that first vaccine appointment as pleasant as possible so that the little ones are happy to go back for a second jab in 8 weeks.
Kathleen Calderwood reporting there.